one of the clinical directors at Montrose Midwest. And on behalf of the entire Montrose team, I would like to welcome you to tonight's event, Every Step of the Way. At Montrose, there is no such thing as a kid who is ever in too deep. At Montrose, there is no such thing as giving up. At Montrose, there is no such thing as discouraging words. In fact, it is the very opposite. The English translation of the word Montrose is steps. Montrose is all about providing our kids the stairs they need to help them out, step by step, out of the pit they have fallen into. At Montrose, we provide assessments and counseling to the kids and families who need extra support. We provide mentoring and support groups to parents and kids. We have a 24-hour support line to avail ourselves 24 hours a day to those in need. There is no question too silly, no child too close or too far. Every parent, every family, every child is handled with the love, respect, and quality of care that they deserve. However, there is a whole different dimension to the work we do as well. Montrose runs various programs, both in and out of schools, to teach kids how to look out for these pits and how to avoid falling in. This is our prevention program. Our prevention program, be it our school-based curriculum, our Big Sibling program, our basketball league, our lounge, are all about teaching kids to discover, love, validate, and accept the person that they are. We focus on giving kids the tools they need to make healthy decisions, stand up to peer pressure, and to adhere to the values they have been taught. Our prevention programs are not limited to those in struggle. In fact, prevention is the opposite. Prevention is stepping in before the struggle. And so the programs we run are geared towards all. As one of our Montrose Lounge participants put it, Montrose is a place to just be myself and talk about the highs and lows of my week. It is a place where I can talk to people who get it and care. While the scope of the work we do at Montrose is broad, including both prevention and intervention, tonight we have come together to address a critically important topic, and that is the topic of addiction. Some of you in this room may have been personally affected by addiction. Others may simply want to learn more. Whatever your motivation for joining us tonight, our goal is to both educate and support, and maybe even save a life.
Because this is a real, tangible issue that is costing too many people their lives. It's a topic that I'm very passionate about. It's a topic that I'm passionate about because it reminds me of the people that have been lost. It makes it very real to know that this is a life and death issue that we need to not shy away from talking about and dealing. And what's gotten a lot of attention over the last year or so in Tavshayin Vav 5776, this past Jewish year, there have been 88 deaths nationally in the Frum community, drug-related deaths in the Frum community. 88 deaths. That is an astronomical number. It's a number that, as I'm standing here, I have chills just saying. 88 deaths. But the hope is, another study that came out, that 82% of people in treatment identify as having family support. So clearly, the number one thing that we need to focus on is how to support through the good times and the hard times. I saw this study a number of years ago that showed that a home in which healthy modeling of drinking alcohol reflected lower alcoholism when kids grew up. So when kids became adults, they grew up in homes where there was a healthy level of drinking. Having a glass of wine by a meal or by a Shabbos meal, something like that. Healthy modeling of drinking reduced. So there is some value of understanding how to properly model what drinking is. But when drugs and alcohol is being used as a way of coping and just, it's going to have an effect. And clearly, as Frum people, we have our shul environments as well. So those are environments. Rabbi Bender from Darkei Torah came out with this article a couple years ago. He put it on a bunch of different Jewish websites, and he talked about the alcohol abuse in the Frum world. And there were two things that really stood out for me. One was that he said that in all his years of chinuch, in all his years in education, and his it's been around for a while, the total cares, the total disregard for the norms of drinking in our From community has reached like this all-time high. We've, as a community, forgot how to drink. So we're just completely modeling unhealthy drinking as a global From community. You know, always loving and accepting an open dialogue with our kids. And the truth is, we don't always have to have the right words. We don't always have to, know what to say or how to say it, but that general emotion of, I care about you and I love you and I want to be there for you, that comes through whether you get the right sentences from the professionals, right or wrong. So just be there for your kids and loved ones, and that's it. I'm talking about addiction, and we'll wrap up with this. Addiction is a disease. Addiction is a disease not different than diabetes is a disease. It's a highly treatable disease. Recovery is possible. It can be a fatal disease, but it's a disease. And between 10 to 20% of the population is affected by addiction. The maintenance aspect is crucial, and we need to support that because most drug-using people have drug-using friends, and they need a healthy, non-drug-using community to be able to help them continue to live a sober and clean life. And that can be an indicator, and I'm saying an indicator, of whether or not they're part of the 40 to 60% of addicts that relapse or not. The only thing that we could do also is to really just ask Hashem and to guide us and to look out for us and our kids and to grant us the serenity to accept the things we cannot change, the courage to change the things we can, and the wisdom to know the difference.
So I really appreciate Madrigos Midwest for giving me the opportunity to talk this evening. Actually divided my speech into 3 parts this evening. I'm going to run through the life of my son Yis. As far as Yis was concerned, he was never a lover of school. He was very cute, he was very precious. He made a lot of friends. He had them throughout his all his 8 years there. He was very athletic. He was very loving. He had a big heart. He was a very good friend to everyone. He was he loved to write. He started the school newspaper, and he was in charge of the carnivals and all the fun things. And what was interesting about Yis, even when he was young, is that he was very, very brilliant. And I never saw him with studying for a test or preparing any kind of a report. And yet he always brought home A's, and he was a very excellent student. And he came home, and it was not it wasn't good timing, because I was actually having our 7th child, and it was in January of 1996, 1997. And that first Shabbos home was probably the first Shabbos of his descent, I'll call it. That was the first Shabbos that really changed my life, I think our lives. I never encountered anything like this. I thought I had seen everything, and I'm going to say that over and over again. The life of someone who's been through the struggle, every time I thought I saw something, it was nothing compared to what was to come and what was to come and what was to come. I lit the candles at Shabbos, and Yis was not home. And that was not in our, that was not something I can imagine. Like, where was he? He had run away. I thought for sure he was in a gutter somewhere. I had a newborn baby in my arms, and I went outside looking for him. We were living on Sherwin Avenue at the time. I called the police because none of his friends knew where he was. I was just frantic. I think my credit cards were missing at that point. I was just imagining, who knows what I had been watching or reading, but I was just imagining the worst. I was like, and I don't know what triggered it. I really didn't know what triggered it. And I know that he was going through a rebellious stage. I understood that very well. I'd been going to parenting classes, and I learned the lingo, what to say, and I was listening to Rabbi Horowitz tapes for over and over. I had them memorized. I love you, you're doing great, you're the best. And I was really getting worried, and the whole night, I remember the police coming. There's a panic. When the police come to your house, there's a panic. Then it even gets worse. You really can't fill out a report. It hasn't been that long. I said, I'm telling you, my son, there's something wrong. And we had to tell him what he was wearing, and that was just, I'm not going to spend time on that. He did come back by the afternoon. He did not give any apologies. He did not give any reasons. Had the best doctors. So we had doctors that the people in the community would suggest to us, we have the best doctors, let him go to this doctor. And they were amazing doctors. And I will tell you, they were trying to get to the bottom of why Yis was acting the way he was, and the words came up, manic depression. That, there's something very strange with him because he had these highs and these lows. Now, remember, manic depression, a manic depressive disorder, we were in 1996, still wasn't that known. And, okay, it was just beginning to get popular at the time, bipolar. And the doctor believed he had it. And I'll be honest with you, it's something that we kind of did not agree on. My husband, he doesn't have it, he's just excited, or he just has depression. And it's still, there's no test. You can't take a blood test and say, okay, he has bipolar. This is from a letter that Yis wrote. At the age of 15, the doctors decided to give me a license to kill. I was diagnosed with manic depression. I would now be the devil himself and not be at fault. I went from doctor to doctor, from therapist to therapist, and from medication until I finally found one that worked, drugs. By the age of 16, I was out of school and going nowhere and doing whatever I wanted. That's really how Yis looked at it. He was happy to have that diagnosis because now he didn't get in trouble. I have a diagnosis. Hey, don't start up with me. I'll never forget one time I took him to Dunkin' Donuts and I walked in and I couldn't hide it if I tried. And he went in really loud, a lot of people wanted, excuse me, I've got bipolar, you better help me because you don't want to start up with me. And the lady, sure enough, he handed him a coffee. He said, you want a donut? Get out. That's fine. He was, I don't know if you remember Kosher Carrie, he did that there. It was almost, I didn't want to go out. I was just like, there was times, and I had to put myself together, talking about journey, I would put myself together and go to work and, try to hold it together. It's a long journey. It was a long, long journey. And now I'm going to give you some of my own personal tips, and then we'll just end, and then you can have. I just want to say one more thing before I give you my little takeaways. Life goes on, and there are simchas, and there are family vacations, and there are happy times. But it does cast a shadow on everything. There's no question. There's a part of you. And there's weddings that he missed, not after he died, but before he died, and he was in rehabs. It was hard. And sometimes, it does cast a shadow, and it's always, that's just the way it is. That's what it does to you, addiction. He wrote a lot of letters to Hashem and just poems. And he cried, he said, Hashem, and he davened, and he learned. And he said, I didn't ask for this, Hashem. I didn't, I'm in pain. But he really still had this conversation going with Hashem. And I think that we can all learn from that. We don't understand everything Hashem does. But we need to remember that Hashem is there for us. And that Hashem, whatever he does is good. And that we're still his children. And that we want Hashem to be watching over us. And that I'm going to agree with you very much that you should always keep the communication open. I think there was a time I had a chance to ask Rabbi A.J. Twersky, who writes all those many, many books, and he said no matter what, keep the communication open. That's number one. I think somebody else that I spoke to, always have food, ready for him if he comes home. Make pretend you had waited for him. I saved this for you. He's important to you still. Besides saying I love you and all those things, just have something special for him if you know he's coming home. He's still important to you. Don't blame him. He didn't ask for this sickness. Okay, I understand the addiction. We'll never understand it. We really won't. It's a sickness. Just like you said, it is a disease. It is a sickness. And one more thing with that. You said something about it. It's like diabetes. The only difference is to me is when you have a sickness, you have someone in the hospital, you go visit them, you send a meal. When you have addiction, you don't get anything from anybody. No one's calling, no one's coming to visit, no one's bringing anything. You're in this alone. No one's calling to say, how are they? They stay away from you. When they see you in Jewel, they go down the other aisle, they say, don't bother her. So it's very, very hard. It's different from other sicknesses in that manner. And keep davening, just like you said, just to keep davening. And, and remember to, this is what I wanted to end with. Here it is. So to learn from Yis that even so, he had a hard life, that his main thrust was to he still believed in Hashem, and he loved Hashem, and he connected to Hashem, and he begged Hashem to help him to the very end. And that's what we should all remember. Thank you
The
so much
things
for
that
listening.
Hatzalah sees, we don't have the opportunity to really talk about. Is that a lot of the people that we do interact with, it's not our job to talk to them afterwards. And we are the smallest piece of what somebody who has an addiction needs. I'm very grateful that there are people in the community, that there's Madrigos, and that there are others, because the ongoing commitment that these people need, I'm very grateful that there are other organizations to do this, because that's what we cannot do. So thank you very much, Madrigos, for asking us to come out here and telling us, let you know what we can do. Okay, so let's see if this is working. All right. So just a little bit about Hatzalah Chicago. We were established in 2009. We've been operating since 2011. We're all volunteer. There's no paid positions. Why they're not like it. So if it's not effective, that's for respiratory depression, because it might be alcohol or some other type of drug. Nasal spray tonight. We have a few samples that they brought that Montrose has from these auto-injector ones, kind of similar to an EpiPen. This one model actually talks you through it. I don't know if they're even approved. I've never really seen them frequently before, but they used to have the same format that they used for AuviQ, which was an auto-injector for allergies for epinephrine. The idea here is obviously that you're going to pull off the cap, and then it talks you through the process.
If you are ready to use, pull off red safety guard.
So you're going to take off here, the needle's going to come through the bottom, and you're going to be injecting it the same way that you would with any sort of auto-injector into a muscle area. Usually they tell you to go through the thigh. These units are pretty strong enough they can actually go through. So the suspected overdose, when do you give it? The answers are pretty straightforward. If there's a history, if you see any paraphernalia lying around, and the pinpoint pupils, in combination with, and again, that's the biggest point, the lack of breathing properly. Whether it's no breathing or whether it's slow breathing. Less than 10 times a minute is not really, is going to be hypooxygenation for the body. They need to have that better oxygenation, and 10 breaths a minute is not really sustainable for that amount that we need. So here's basically how it's going to work. It goes into the nasal cavity, and it gets absorbed through there into the bloodstream, and then it can get to the brain and systemically. I want to kind of recap what the critical part is, and that is, one, don't go at it alone. The reason that I kind of spoke about why you don't go at it alone with your Narcan is because you don't know what